Hour number 19, Senator Cruz laying out some of the problems he sees with the Affordable Care Act.
Mr. President, Obamacare was told to the American people, if you like your health coverage, you can keep it. We now know that promise was simply, objectively, 100% false.
Alan Colmes, host of the Alan Colmes radio show and a Fox News contributor. Katie Pavlich, editor at townhall.com. She too a Fox News contributor. Good morning to both of you. This is something else, you know. I mean, you had Rand Paul doing it. Now you have Ted Cruz doing it. And Katie, where does it lead, knowing the rules of the Senate are going to cut them off at 12 noon Eastern time?
Well, it leads to the American people appreciating Senator Ted Cruz for standing up for what he believes in, but also for standing up for what he was sent there to do. He's one of the people who ran on repealing Obamacare, defunding Obamacare, doing whatever he can to stop Obamacare, and he's taking a stand and teaching the American people about Obamacare. If you want to learn what's in that bill, listen to the talk that Ted Cruz has been giving for 18 hours now about what's in it, because now we know, as he just mentioned, you can't keep your doctor. He talked about, and Senator Rubio talked about this as well, Obamacare crushing the American dream, not allowing for more opportunity. And so he's saying, it's going to go to the House after this because they will vote to send it back, stripping it of, they'll keep the funding in. But this really shows that he's willing to stand up for his principles and say, look, Katie, we're not going to back down. We're going to have this fight. Do you believe,
for the Republicans who are against him, some of them publicly, is this changing their minds, yes or no?
No, I don't think it is, and that's unfortunate.
It's not changing the argument, not changing the debate, not changing the issue.
It's not changing the argument in Washington, but it's definitely changing the argument out with the American people where it really matters. And we have an election coming up next year, and that's what really matters here, not what the senators and John McCain is saying.
Alan, what about that point? Maybe you don't affect things in Washington, but you have a significant impact on the American public.
Well, the polls would indicate that Ted Cruz is having an effect on people's view of the Affordable Care Act. They don't want to defund the government. They don't like the game that's being played. His biggest critics are the Republicans. I didn't give Ted Cruz enough credit, honestly, to tell you the truth, because he is fantastic at bedtime stories, and I should have given him more credit for that.
He could read you one. Listen, here is what he is debating, and you're going to hear more of this in the coming days in the House. Medicare cuts delayed. The employer mandate delayed.
Right.
Subsidy verification delayed. Out-of-pocket caps delayed.
Right.
2,000 businesses and unions get a waiver. Congress gets a waiver or a subsidy to pay for their own health care. Katie, this is the crux of his argument now.
Right.
That the bill, the law as it is right now, said to go in effect on Tuesday, looks nothing like the law they passed 3 years ago.
Absolutely, and I think it's unfortunate that Alan would belittle this conversation down to trying to slam Ted Cruz for a bedtime story.
I'm not the one who did it, he did.
When you just laid out all of the things that we're actually talking about here, we're talking about a system, an Obamacare system that divides people up by class. And we mentioned, or Ted Cruz mentioned this, Senator Rubio mentioned this, or Senator Rand Paul has mentioned this. All of the people who have friends in Washington in high places get a waiver for this bill, while the little people in the middle class that President Obama claims to represent don't. And they're the ones who are losing their jobs, they're the ones who are working part-time now, and they're the ones losing their health insurance and unable to afford a care even under Obamacare.
Let me get some facts on the table. The waivers are temporary. One of the reasons that it's being held up for certain reasons is because the Republicans have put roadblocks on red state governors, for example. They have not implemented the exchanges they were supposed to by the deadlines they were supposed to. They've done everything they could to stand in the way of this, which is one of the reasons part of it is being held up. When you go to the American people and you ask them, line item, what do you like about this? Do you like portability? Yes. Do you like no punishment for pre-existing conditions? Yes. Do you like the fact you can kids stay on your parents' plan till 26?
Well,
yes.
You could have done a lot of that with overhauling the entire
but that's
system.
Not the Republicans have come forward with. They don't have the plan.
I got it, Alan. When we ask the American people how the implementation is going, this is what we find.
It's a joke.
57% say it's a joke.
Absolutely. And you know what the American people don't like? Is they don't like navigators who aren't going through background checks, who are going to be in the intricate details of their health care.
That's the next phase of this story. Listen to both of you. Ted Cruz will continue his speech. Can't call it a filibuster officially. But we'll continue this debate, too. I got to run. Thanks, Alan.
Thank you.
Thank you, Katie.
Thanks,
See you next time. Martha, what's next?